So our next and final speaker for this afternoon is Christina Nelson. She's medical epidemiologist, Division of Vector-Borne Diseases at the Centers for Disease Control and Prevention. So hang on.
All right, well, hello everyone. Thank you to everyone for being there, and thank you also for the opportunity to be a part of this meeting. I wish I could be there in person, but hopefully we can still have a valuable exchange of information even from afar. So today I will be talking about strategies and materials that we at CDC use to educate others about tick-borne diseases. So the objectives of this talk, first I will discuss how we determine information needs related to tick-borne diseases. I'll review some CDC materials offered for clinicians and public health practitioners. Next, I'll review CDC materials that are offered for the public. And lastly, I'll introduce Lyme Core, which is a train-the-trainer program for tick-borne disease prevention and education. So first of all, to find out what they already know, we use DocStyles surveys and qualitative interviews, which I'll talk about in the next slide. What do they want to know? Again, we use qualitative interviews. We look at internet hits, so what are they searching for and viewing on the CDC website? What specifically do they have questions about? And also we get inquiries to CDC from clinicians, and so that allows us to talk to clinicians about what they're seeing, what questions they have, and suggestions for information. And lastly, how do they want to get information? We want to know how they prefer to get the information so we can best provide that. So again, we use online methods, looking at internet hits and what they're using, webinars and meetings to get that information as well. So next slide, please, for the DocStyles survey. In terms of surveys, the DocStyles survey is a national healthcare provider survey that covers approximately 2,000 clinicians throughout the U.S. each year. And it provides regional estimates. We don't get state-specific information about the responses, but we do get regional information, and we get other information like provider type and practice characteristics. And it's used by many CDC programs and other research institutions, and we submitted questions related to Lyme disease in 2009 and also 2011 up through 2015. So that is a good source of information for us. Next slide, please. Here is an example of the type of data that DocStyles can provide. So this is a chart. We asked providers basically, where do you usually get your information related to tick-borne diseases? And respondents could choose more than one answer, so the percentages add up to more than 100%. But we found that nearly 2/3 of respondents, these are, again, clinicians, this is both physicians, nurse practitioners, and physician assistants, found information at the CDC website. So they do tend to go there quite a lot for information. They also use other websites, published materials, meetings, and published guidelines as well. Next slide, please. Next, related to information and interviews, going on the road, basically. So we exhibit at high-impact medical conferences to distribute materials and meet frontline providers. Here's just a list of some examples of meetings that we've gone to. And we can really get a sense of what's on their minds, what are frequently asked questions, and again, suggestions for materials that they would find helpful and have been asking for. Here's just a picture of one of my colleagues here at one of those meetings. We focus on educating clinicians about prevention, of course, of tick-borne diseases, so primary prevention, and also early recognition of infection when it does occur, so secondary to prevention to prevent later sequelae of untreated infection. But other things do come up. There is one misconception recently, and that was actually mentioned in a previous presentation today about the reason that the ILADS guidelines are the only ones on the AHRQ website. So AHRQ is the Agency for Healthcare Research and Quality, and they do post guidelines on their website. But they actually have a policy that they only post guidelines that have been revised within the past 5 years. So the reason the IDSA guidelines were removed from that clearinghouse website, the AHRQ website, is simply because the guidelines have not been revised in the past 5 years. It's not a judgment call about one guideline being better than another. It is simply because they are following that rule of guidelines needing to be revised and published within the past 5 years. So that's one misconception that's out there that we try to clarify and help people understand the reasons for what they're seeing there. Next slide, please. So the next steps, after gathering this information, we need to put it to use. Next slide. So I'll review some of the resources we have for clinicians and public health practitioners. Next slide. So if you go to our website, cdc.gov/Lyme, and click on healthcare providers, which you see there within the red circle. Next slide. We have various educational materials. So in response to questions about serology, we developed this flow chart. As you know, it's a two-step process. So the first step that should be done is typically the EIA, the enzyme immunoassay, that if positive or equivocal should be followed by the Western blot. So we developed this algorithm to help explain the process, and it's available on the CDC website for download. It is not recommended to go straight to the Western blot. The two-step process was developed because it's the best balance of sensitivity and specificity. We do not recommend using individual bands or going straight to the Western blot. That can lead to false positives. It's important to remember that just because something is a positive test or gives a lot of positive results doesn't necessarily mean it's a good test. It needs to be an accurate test, it needs to be clinically validated, and it needs to have good specificity. So the reason that we recommend this two-step process, again, it's the best balance of sensitivity and specificity and helps avoid false positives that can come up by going straight to the Western blot or interpreting individually positive bands and not using the criteria of at least 2 out of 3 bands for IgM and at least 5 out of 10 bands for IgG. Next slide, please. We also have this Tick-borne disease reference manual, which Dr. Moore mentioned. It's a quick reference guide. It was originally developed by Massachusetts, so I have to give them a shout out for that. It's been very popular. It was very popular with them, and so we worked with them to expand it and make it for the entire U.S. The size, it's a glossy booklet, basically. It's very handy. It's about 6 inches by 9 inches, so it's easily it can easily fit in a bag or someone's office. And you can get the PDF online. You can download, again, cdc.gov/Lyme. It's right there on our homepage if you scroll down a little bit. People can also order hard copies at the website below. For Canada, we do have some restrictions on shipping internationally, and it has been so popular that we are currently out of stock. But if you want hard copies when they are back in stock, on my last slide I'll give you the information for someone to contact if you want to order some of those. But it includes tick identification, maps of where diseases occur, symptoms, laboratory diagnostics, treatment, references, and of course tips on prevention of tick-borne diseases. Next slide, please. So a little bit more about this manual, a little peek into the inside. So we have pictures of 9 different ticks, the most common disease-causing ticks in the United States, and includes information on their geographic distribution and the pathogens that they may carry. In a more recent edition, we added a picture of an engorged tick. Based on some research we had done, actually, we found that providers actually had some difficulty identifying engorged ticks and actually thought that maybe it wasn't a tick or it was a trick question, and so we thought it was important to put that picture there so we can help providers and others understand what they look like, and of course, since that's the most likely to have transmitted disease. And then at the bottom, you see the different tabs. We have many different diseases included. So we have anaplasmosis, babesiosis, ehrlichiosis, Lyme disease, of course, Rocky Mountain spotted fever, tularemia, and a whole section with a chart for other less common but also very important tick-borne diseases. Next slide. In more recent editions, we also added a special section highlighting atypical erythema migrans. So I know that's come up a lot in previous presentations, and it's very important to recognize that these are also erythema migrans. It can be confusing to providers and difficult to recognize. And at the bottom, we also added a picture of an allergic reaction, which also can be confused. The allergic reaction comes up usually within the first 24 hours. It's very itchy and it's small. Some people may have questions about whether that's an erythema migrans rash or what is it, and so kind of helping people understand what differentiates an allergic reaction from erythema migrans. Again, it's been very popular. We've had great feedback, and I'm told that some providers here in Canada also use it, so that's great. Next slide. Lastly, I wanted to mention it's also now available as an app to download. So if you go to our website again, you can download it for various types of devices, which can be helpful, especially if the print copy is not available and you can take with you wherever you go. Next slide. We also have on our website short videos to explain various concepts related to tick-borne diseases. We've worked with Medscape to produce some expert commentary videos. They're usually about 5 minutes in length. We did a video on the two-tier testing algorithm, and in the first 3 weeks it had 27,000 views. We also did a video about PCR testing and other various videos. So these have been well received as well. Next slide. And finally, for clinicians, we do various webinars. One venue is COCA-Call, that's Clinician Outreach Communication Activity, and these also offer CME credit. So I've listed a couple we've done in the past, and then we actually have one upcoming next week on May 24th, and CME credit will be available. It will be on updates for tick-borne diseases, so we'll include Borrelia miyamotoi and Borrelia mayonii. Next slide. Next, I'd like to discuss some examples of educational resources for the public. Next slide. Again, if you go to cdc.gov/Lyme, first of all, you'll see we kind of have a rotating slide in the upper right corner, and one of those that you can see here is a comic for kids about preventing tick-borne diseases. It's very simple and colorful and short, and it talks about a camper who doesn't want to use repellent, but then eventually does. So, so we hope that's helpful for kids and for parents. Next slide. And then if you click on the educational materials, you'll see our communications toolkit. So we have brochures to order, fact sheets that can be printed out. There's just one-page PDF fact sheets. We have a lot of prevention fact sheets that have been tailored for specific populations like outdoor workers, hikers, pregnant women, parents. We also have them in other languages, in Portuguese and Spanish. We have radio PSAs that can be downloaded and used for various audio programs. The trail sign you'll see here in the upper right corner, the red and black, prevent Lyme disease, it's kind of made of a thick foam, weatherproof material, and it's been great for posting at areas near trailheads and other places where people would be exposed to help remind them to do tick checks and other things to prevent tick-borne disease. And then lastly, the prevention for kids, the crossword puzzle I mentioned, and then the prevention bookmarks, which of course are for both adults and kids, that have our primary prevention messages on the front and then information on how to remove a tick on the back. Next slide. So just taking a brief look at the amount of interest in materials that are used. Our website in 2015 had 7.5 million views at that cdc.gov/Lyme. And the most popular publication, so the Lyme disease bookmark, as I said, it's been very popular. In 2015, it was the 9th most popular CDC publication of all the CDC publications. There are 136,000 ordered online, so we were very happy about that. We are also constantly revising and updating our content, so check back and sign up for updates. I'll show you how to do that as well on the last slide. Next slide, please. And finally, I wanted to briefly mention Lyme Core. Next slide. Just a little bit of background first. So as we all know, education about Lyme disease is essential, especially prevention messages to prevent the disease in the first place, and also to highlight available resources. We have a lot of resources available, as you saw. I know there's other resources provided by other groups as well, but many people just aren't aware that they're available, and they can be printed and shipped for free, or downloaded and printed. And so we really want to get the message out that those resources are there as well. But the problem is just a lack of manpower. So we only have about half a dozen people in our group here in vector-borne diseases epidemiology group, and we have other responsibilities such as research and surveillance. So we really we developed this program in order to help improve our outreach and basically multiply our efforts. So the objective of Lyme Core is to develop and train a talented, committed team of students and residents who provide Lyme disease education and outreach to both healthcare providers and the public. And the focus is on prevention and early recognition and treatment of tick-borne diseases. Next slide, please. So Lyme core participants basically serve as educated foot soldiers to help spread prevention messages. So some activities, so we collaborate with universities and state and local health departments. The Lyme core participants post prevention signs, they write prevention articles and other things, and it's really been fun because we're able to harness participants' existing talents and interests and connections to help spread those messages. So as you can see in the first example here, we had one participant who was a former botanist, and she was really into gardening, and so she was able to write a newsletter article for the Virginia Master Gardeners newsletter, which gets out to thousands and thousands of people. So that's just one example of how we were able to reach out to people. And then additionally, manpower for occasional prevention research projects. I'm really excited about this, so I wanted to mention it. It was just published in Ticks and Tick-Borne Diseases, and we had help from 2 Lyme core participants to conduct this research. So basically, a little bit of background. The CDC had recommended that you tumble dry clothes in a dryer for 1 hour to kill any ticks that may be on the clothes. But this was actually based on the one published study that was done that was really looking at washing conditions, and then they put all the clothes in the dryer for an hour and found out that, yes, all the ticks were killed after an hour of drying. But they didn't test different drying times, and we had some anecdotal evidence that maybe if you put your dry clothes in the dryer, it's actually much shorter. We couldn't do this study. I'm based out of Colorado in Fort Collins, and we couldn't do the study here because the climate's very dry and it's very different and wouldn't replicate what people in the Northeast and other areas with lots of black-legged ticks would be seeing. So the Lyme core participants were able to help us with this research project, and we found that if you put clothes directly in the dryer after coming indoors on high heat, it only takes 6 minutes to kill all the black-legged ticks on the clothing. So we're really excited about this. Like I said, in addition to helping kill the ticks, it helps people remember to get their clothes off. So when people are outdoors gardening or hiking or whatever, soon after they come indoors, take your clothes off, put them in the dryer for 6 minutes on high heat, and you can kill all the black-legged ticks. This does not, however, apply. We only tested black-legged ticks, so it's important to remember that other more hardy ticks, such as lone stars, may take more time to kill. If the clothing is wet, if your clothing's soiled and you need to wash it first, then it will take about 40 minutes drying on high heat. So the previous recommendation does stand for wet clothes. Next slide, please. So thank you very much. I wanted to acknowledge the Public Health Agency of Canada and also the Lyme Disease Conference Planning Committee. I know they put a lot of hard work into planning this meeting, and we all really appreciate it. Thank you very much. And if you could go to the next slide. I'll leave you all with some information about how to contact us. Anna Perea is our technical communications expert, and you can contact her about ordering materials or if you have questions, and you can also sign up on our website for updates. When we update our materials or websites, you can get notices about that. So I think I was 19 minutes, so hopefully I shaved off a minute. But thank you again, and I'm happy to take any questions.
Okay, thank you, Christina. People are clapping for you right now. You may not hear it.
Okay, thank you.